Welcome to today's webinar, The Meaningful Link in Supporting Individuals and Families, Brain Injury Association of New York State's Family Advocacy, Counseling, and Training Services Program. I am Carla Giovaniello, Brain Injury Training and Services Project Director here at the Association. Thank you for joining us. Before we begin, a few housekeeping details. Because of limited time, we ask that you please hold your questions until the end of the presentation. During the question and answer session, questions can be submitted via the question text box. The text box option should be visible to you on the GoToWebinar toolbar on your desktop. If you are having trouble viewing this option, please contact Citrix Tech Support at 1-800-263-6317. Again, that number is 1-800-263-6317. This number should also be visible on your toolbar. Our speaker will do her best to answer questions in the order that they are received. Any questions she is unable to address may be submitted via email to the Association. We will be recording this webinar session and plan to post it along with the presentation slides to our website www.BIANYS.org. Information about contacting the Association and viewing the webinar will be provided in a follow-up email after the presentation has ended. My contact information will also be included in those follow-up messages. Before I turn the microphone over to Vicky, let us begin with a quick poll to see who is in our audience today. Please take a moment to answer the question. The poll is open. I'll give you about 5 seconds to answer. All right, I'm going to close the poll now and share the results. All right. It looks as though 49% answered, I am a healthcare professional or caseworker. 9% answered, I work in a school system. 5%, I am an individual with a brain injury or a family member. 2% are affiliated with veterans organizations, and 35% are affiliated with a brain injury program or organization. So we do have some variety. As always, I love to see that. I would like to thank you all again for your participation and for helping to spread the word about our monthly webinars. Your support is truly appreciated. It is with sincere pleasure now that I introduce our presenter for today, Vicky Myers. In 1996, Vicky's youngest son sustained a moderate traumatic brain injury. As a result, she became a full-time caregiver and advocate. She joined the Brain Injury Association of New York State, where she has worked for 14 years as a facts coordinator, aiding and advocating for individuals with brain injuries and their families. We also have Erin Weaver with us today, the Brain Injury Association of New York State's Director of Family Services and Policy Development. Vicki, Erin, good afternoon.
Hi, Carla, and thank you very much for the introduction. My name is Vicky Myers. And as you can see the picture, that's me. I will be covering many levels of the FACTS program today through this webinar. Everything from the history to the challenges and the successes of our FACTS program. Next. We're going to start out with a little poll question, get our brains all warmed up like if we were all together and do a little arm stretching, leg stretching. The poll question is, according to new data released by the Brain Injury Association of America, an individual sustains a brain injury every how many seconds?
Okay, I'm going to launch that poll now. Please take a moment to answer the question. I'll give you about 5 more seconds, not minutes, to do so. All right, I'm closing the poll, and I'll share the results. It looks as though we have some answers across the board here. 30% answered every 10 seconds, 18% answered every 24 seconds, 22% answered every 17.5 seconds, 23%, the most under the 10, 30% for 10, is every 60 seconds, and then 12% answered every 18.5 seconds.
Well, as you can see, the answer is 18.5 seconds. Excuse me. And under our newest data from 2009 shows that we have roughly 3.5 million people who sustain a TBI each year. Many people fall through the cracks due to the fact that there is such a limited public awareness on brain injury. Thus, the massive need for facts and the supports that are needed to help these individuals strive for their goals and become as much or as close to the normalcy that they were prior. I guess I should have mentioned to you, I'm getting over a cold and I have laryngitis, and I don't normally sound like a squeaky wheel here. And if at any point here that my squeakiness gets so annoying, I may hand things over to Erin a little bit, give my voice a little rest, and then come back. So I apologize for that. Bear with me, please. Next. Sometimes when someone states specific numbers of cases in a year of brain injury, it's hard for one to relate to. However, when you see it as in comparison to other diseases that we are very familiar with, it is, I'm sorry, in comparison to the other diseases, it becomes more familiar with it. It becomes almost unrealistic. When you add the totals of the first 4 diseases diagnoses listed here and realize that, in fact, it's less than half of the TBIs in a year, we begin to become and visualize a truer picture. Supporting the need for facts and more supports for individuals with TBI is very important. A breakdown of incidence in ratio to levels of severity is 80% are usually mild, 10 to 30% fall in the moderate category, and 5 to 25% fall within the severe. Not to say that a mild head injury is not a complicated, or a mild to moderate is not a complicated case to work with. Next. Family Advocacy Counseling Training Service Program, which stands for FACTS. This is just a general overview that you can take a look at. I might mention that OPWDD stands for Office of People with Developmental Disabilities. It was originally called OMRDD, which was Office of Mental Retardation Developmental Disabilities. But the political term was changed roughly 2 years ago, and we now fall under the Office of People with Developmental Disabilities. Of course, our acronym OPWDD is used widely across the state. Next. For most in New York, facts may be a familiar term. However, in other states, it's probably quite foreign to you. And similar services / programs have different terms such as resource facilitation, neuro-resource facilitation, training coordination, educational liaison. Eligibility, though, however, is often a little different as well. as the specific services provided, excuse me, but many having commonalities. An example of such is in Iowa and New Hampshire. They have extremely sophisticated and well-developed resource facilitation programs. Vermont provides neural resource facilitation, but however, in New York State, the focus of the FACTS program is that the injury, DOI, must occur prior to age 22. Next. In 1982, a small group of families joined together and with the help of their local legislators and supporters and representatives, as well as individuals at TBI, began a volunteer organization called New York State Head Injury Association. The main headquarters for New York State were located in Albany, New York. Oddly enough, this is the same year that the Brain Injury Association of America started as well, under the heading of National Head Injury Foundation. Initially, volunteer chapter chairs, regional coordinators, all of which are parents and or family members of individuals with traumatic brain injuries, were given the responsibilities to advocate in the regions that were established by OMRDD, keeping in mind that OMRDD stood for Office of, excuse me, I'm very sorry, standing for the Office of Mental Retardation, Developmental, and Disability. The individuals who held those positions were elected by their peers within their own regions and were accountable to the family support funding under the OMRDD state agency guidelines. Over time, the reach out of these programs was expanded through additional funding. The regional directors and chairs collaborated with the New York State Injury Association and continued to keep their records and report to the individual DDSOs. DDSOs represents the Developmental Disability Service Offices. And I should mention that there's a DDSO or a breakdown of small DDSO offices in each of the regions designated by OMRDD at that time, now OPWD. Approximately 10 years later, the New York State Head Injury Association became the Brain Injury Association of New York State. While doing so, at this point, the regional directors who were under volunteer positions were given the opportunity to have the title of FACTS coordinators if they chose to take the paid position funded under the OMRDD grant. Eventually, the individual grants were continued to one grant covering the state as a whole to be used and seen fit by the Brain Injury Association in New York State under the perimeters of the contract. Next. The expectations of the FACTS program has always been, and probably will continue to always be, to identify individuals with traumatic brain injuries and offer supportive counseling, service linkage, advocacy, training and information, and referrals to those individuals identified with TBI. The FACTS coordinator works closely with the family support service coordinator and the TBI coordinator from their local DDSOs. Again, the DDSO stands for Developmental Disability Service Office. Next. This is an original contract that was established with the Family Supports Office of OMRDD and BIANYS. I'll just give you a few minutes to look that over. Next. FACTS, excuse me, works under a funding source through a grant from now OPWDD, originally OMRDD, and it's pretty self-explanatory. Yeah. Okay, so I'm not going to be able to speak. It's pretty self-explanatory here. Right now, since the year 2012, we are at a budget of $599,000. We did receive a 10% cut from 2012. Under the amounts given for our annual basis as discretion of OPWDD, we wait each year to find out where we stand with our budget amounts. For funding sources that cover our salaries for the 14 FACTS coordinators across the staff who work out of their homes, FACTS director, the support staff, administrative costs, travel, training, supplies, postage, phone, internet, health insurance, which falls under our administrative costs. We have 5 of the 14 FACTS coordinators that are full-time, 9 which are part-time. Our administrative costs are allowed to rise to the level of 15%, and our health insurance is prorated for all part-time employees. And as I kind of made note to, our contract is renewed annually, and BIANYS has contract deliverables as part of the grant that is submitted quarterly to the funder. We'll be discussing that further down the slides. Next. Five service categories that we report on are family advocacy, educational advocacy, information resources, outreach, prevention, and training. Under IQS, which stands for the Individual Quarterly Summaries, we report the dates of service that we work with the individual, the number of hours that we spend with the individual per day, delivering the 5 different types of services that are documented here. Under the AQS, which summarizes the total number of hours spent for the quarter engaging in the 5 FACTS services, we put the total of FACTS participants served by each coordinator in the quarter, the total number of new individuals served in the FACTS program, the total number of individuals served that are either excuse me, not FACTS eligible or not registered for FACTS at the time of the report will fall under our OP. Now, our OP form represents all of the quarterly activities associated with outreach and prevention that are not directly linked with FACTS participant as an individual. What does that mean? Our FACTS participants, anything that we may do for them, we specifically put under the IQS. That includes talking with their doctors, that includes meetings with them, That includes individualized trainings that we might do for them. However, if we're doing generalized trainings, or we're talking to a group of doctors and discussing our program, or giving information, attending health fairs, things like that, doing trainings, attending helmet programs, calling hospitals for general information, or building relationships for referrals. This all falls under our OP. Awareness activities and non-facts falls under the OP. Next. Most of the FACTS coordinators have been impacted by a traumatic brain injury in either their personal life as parents, siblings, children, or friends. As most know, there are no two brain injuries that are alike, and I'm proud to say that neither are the FACTS coordinators. However, the strongest commonality they share is to ensure that no one faces traumatic brain injury alone. Each FACTS coordinator works diligently to provide their information, service linkage, emotional supports, and community supports to aid the individual with TBI to improve their personal outcomes. The FACTS coordinator also works with the guidance and support of the FACTS supervisor, the executive director, our supportive staff in the Albany office, excuse me, and each coordinator develops his or her own directory of resources and relationships with individuals, agencies, and so forth who service the brain injury population. They are the link of information and supports to enable the individuals from the present to the future. And as a personal touch, as one of the 14 FACTS coordinators, it has been a privilege to work with our diverse group and have been fortunate to learn and share from their specific strengths. Some are excellent in facilitation. Some are totally terrific in researching and organizing. Others excel in education. But together we make a unique group of individuals when the challenges are difficult. But most commend the successes of each other. We work as a whole. An example of this might be, I'll use myself as an example. I work and cover the Western New York region, which is the farthest end from New York City. I'm a very rural area, and so rural that the county that I live in, this is a little funny note to add, nothing in this county is big enough to be called a city. So I probably don't have to explain to you how difficult it is. We have no public transportations, we have none of the resources, and we have very, very few choices to give to our individuals with TBI as far as services and so forth. When I'm looking for someone who needs residential placement, or I'm asking for information on something that maybe I want an intensive rehab program, it goes out in an email to all the girls, or if I know specific areas that I know have larger facilities, I make a phone call and I ask them what they think they have to offer and what they might recommend for me to make those phone calls and see about placement and what that criteria might look like. It is such a unique group of people, and our strengths are so far diverse that when you put us all together, we turn into like one individual. And I am proud to say that this works well. We work together regardless. Even though we may only see each other face-to-face once a year, we come together for our annual conferences. I'm sorry. And I hope I'm not bothering you people. Due to our budget restrictions, I'm proud to work with this group, and even though it takes a lot of creative thinking to do our global meetings and emails, and seems like we are, and it still gives us the feeling that we are in an office facing each other, and we make it work. The goal is to give our individuals with TBI dignity, respect, and choices. That is something that all individuals on this earth deserve. And as FACTS coordinators, we make sure that happens. The most important service that the FACTS coordinator does in the world of traumatic brain injury is to enable dignity, respect, and provide an avenue for choice. Next. The New York State FACTS coordinators are located in each of the OPWDD designated regions of service. There'll be a map following this that you can take a look at, so I'm not going to get in great depth about that. They can be found anywhere from their homes working on the phone or computer to schools advocating for children with traumatic brain injury and the services that may be needed for their education, to universities, colleges, local hospitals, and agencies conducting trainings, conferences, and seminars. Actually, you can find FACTS coordinator anywhere you might think of. These unique individuals always provide an avenue for individuals and their families to reach them. The BIANYS website displays a list of the FACTS coordinators, names and numbers, as well as our email addresses and phone numbers. A little off the side here, but in my experience over the 14 years, I have, and I know many of the girls have done the same, we have been in contact with individuals in need of help in grocery stores, as I'm sure many of you can relate to, at your neighbors, or visiting a friend. I specifically have a family that calls me every time there is someone in their small community who suffers from a brain injury, asking me if I would please talk to the family. They're not concerned whether they're available for our waivers or what the status is. They just want them to have someone to talk to who will understand. And I always, of course, say, give them my phone number. If they choose to call, I'd be more than happy to talk to them. We do a lot of networking, and it may be just that we need to talk to someone who understands. When I say that comment, you say, well, you're the one supposed to understand. However, many of our individuals contact us through resources that have been explained to what we do. And we don't so much have the background, so we need to sit back. We need to learn how to listen, and we need to take in the information due to the fact that TBI is not generic. I know that some of you can also relate to the fact in other situations like weddings, church gatherings, or situations when someone walks up to you and says to you, do you work for BIANYS? Could I ask you a question? I have found it funny over the last probably 7 to 8 years. It wasn't always this way, but my husband will politely, quietly walk away as he knows I'm going to talk to these individuals, give him or her my business card, which is always in my purse, and try to help them or network them, or at least say, give me a call when you get back home. Being a facts coordinator, to me, isn't just a job. It's a way of life. We care, we share, and we listen. Next. This is the map that I made note to. If you look across, you'll see the different facts coordinators and the different colors used for their regions to show you representation of what they cover with their phone numbers. Under this, FACTS is a free service for individuals with TBI and their families. We support parents at CSC meetings. We link to agencies for TBI services and many different trainings for schools, professionals, and families. FACTS programs helps individuals who sustain their injuries prior to the age 22 and their families. Important to remember that under the FACTS program, we are not only there for just the individuals, but also to support the families. We can help at any age as long as the injury occurred prior to age 22. At this moment, I'd like to also reflect a situation that we have at hand. Unfortunately, my peer, one of the 14 FACTS coordinators in the Long Island FACTS coordinator, as a FACTS coordinator, has just completed her second master's degree and will be moving on to another position outside of the Brain Injury Association and leaving this position as of today. Next. The FACTS coordinator can help anyone who's been impacted by traumatic/acquired brain injury from birth up to age 22 and their families, as I kind of mentioned too, regardless of the individual's current age. Now, an example of this might be John has a TBI. He's age 16. Today he is now 30. He has bounced around various admission as inpatient for substance abuse substance abuse facilities. I'm sorry, it's starting to get squeaky. Erin, you might want to get ready for a little bit. Treated with mental health, making that dual diagnosis, substance abuse versus TBI is the whole picture. However, is he eligible for the FACTS program? Yes, as he was injured prior to the age 22. In fact, he was injured at age 16. It is also worth mentioning that FACTS coordinators work with individuals with concussions, post-concussion syndrome, which is a mild head injury, and again, we work between the ages of birth to age 22. Next. I think I can do this one, Erin. This is pretty easy to get through. Referral sources. A little information for you about where they come from. As a FACTS coordinator, when we first come on, our job is to go back and start setting up our list of resources and providers and individuals that we come across that work in the fields of brain injury. Most of our referrals come from hospital social workers, discharge planners, teachers, counselors, providers, friends of other individuals who have brain injuries, friends of the family whose children have them. For example, today I received a call from a friend of an individual asking for help for her friend's husband. These scenarios are endless. Intake forms give us a basic information needed, such as date of birth, date of injury, phone numbers, address, email. After we complete this process and we make a list of the individual's needs, we also discuss our grievance procedures. If the individual / family are not happy with the way the FACTS coordinator is working with them, they have the right to contact our immediate supervisor. In our case, it's Erin Weaver. And if they still are not satisfied with with the answers that they are given, they can take it further to our executive director, Judy Abner. I tell this to each of my families upon the initial contact, and it is in writing. Discuss release consent forms for information before they sign them, explaining why we need them due to HIPAA, and the reason that we follow these strictly. Discussing confidentiality, as they are concerned as to who receives this information, how, and where. Remembering this is their lives and their choices, not ours. Next. I'm just going to take a sip of a drink, so give me just a second.
Vicki, we have about 20 minutes until a question and answer session. I just wanted to give you a quick time check.
Okay, thank you.
You're welcome.
Okay, F is for the F in FACTS. Information about brain injury-related topics provided to the family and individuals. The Brain Injury Association of New York State has many different pamphlets, brochures, and various booklets, and so forth. What a FACTS coordinator supplies to an individual with traumatic brain injury or his or her family usually depends on the timing of when we've been contacted. But most usually we hand them a copy of our FACTS brochure, Understanding Brain Injury, our business cards, and any information that is pertinent to the needs of the individual at that time. Even if this requires us doing some research, if we don't have pamphlets that will do such. And most importantly, we give them the respect that they deserve as human beings. We acknowledge differences in all situations, advocate for the individual, not TBI generic. We start by giving them back choices for services, programs, waivers, education and support groups, and when their choices are slim, we explain why. Next. A is for the A in FACTS. In school districts and colleges, we advocate providing supportive information for those individuals with TBI who are in need of services. In the community, seeking state and local services, as well as those across the state if need be. We advocate in disputes, fair hearings, and evictions, such as Social Security, Medicaid, rental assistance, or evictions, incarcerations when there is a need for medications, or to prevent issues from going further. We can give information on traumatic brain injury, help them to understand. We advocate within the family, providing an avenue for the individual to be heard, for admission into programs such as substance abuse, related services, and acute rehab facilities, and so forth. Giving real-life examples, we work in schools, we provide the tools and the information to the parents and helping them to understand their rights. We also try to direct that the children and the family are being spoken to and not around, and the individuals with TBIs that we're advocating for know what their choices are. Next. C is for C in facts. Ongoing emotional supports. We are not clinicians, but we are not clinicians, and we must make sure and clear from the beginning that our individuals and families that we're working for know that we offer emotional supports, and we also do not diagnose. We leave that to the doctors. We do not challenge doctors. We use their reports and recommendations to help the individual. We counsel through various formats, frequent phone calls, face-to-face meetings, emails. All the various types of counselings are used by FACTS coordinators according to need and availability. Each relationship that we develop and establish with an individual with TBI is customized by the individual needs. Next. T for T in facts. The importance in collaborating with agencies and contacting BIANYS for TBI training for staff. FACTS coordinator provides trainings in Learnet, REAP, and basic TBI to youth transitions. We also attend trainings, promote working with our agencies. We ask our agencies, schools, organizations, and so forth to become members of our BIANYS and for them to cover our travel mileage costs in order to come in and provide our trainings. Also, we provide prevention programs to schools and communities, such as health fairs, helmet programs, and awareness and different events that the FACTS coordinators schedule. Next. S is for the S in FACTS. FACTS coordinators are not clinicians, needs to be mentioned again, then as I have previously done so, and the counseling is supportive. FACTS coordinators refer to the family to the licensed counselors in their areas. Although we are not direct services, we do provide direct services through empowerment and enabling the individual with information and tools to learn to advocate for themselves. However, there are always these situations that prevent the individual and sometimes the families by doing so based on their abilities. Therefore, the level of involvement depends on the abilities of these individuals. Some impairments, such as inability to organize thoughts, reasoning skills, memory, short-term, would inhibit these abilities. As a FACTS coordinator, we serve as a major resource for educational information in our communities and schools and so forth. Next. Advocate. One of the most important things that we do. Make referrals and assure the linkage to services needed. Example, to the home-based community service waiver. Service coordination can list all of the agencies that provide services for the individual to choose from and provide information, education on traumatic brain injury, acquired brain injury, concussion, prevention materials, and the list goes on and on. We conduct trainings in schools, agencies, hospitals, as I've stated before, on everything from TBI 101 to our newest program, REAP, which has a component that's been added by the name of Return to Learn. Provide the emotion supports needed and remember to listen. Next. Strategies to keep connected when working remotely. How? Well, there's a way. There's a will. Where there's a will, there's a way. FACTS coordinators' determination and ability to think outside the box. As we were facing budget crunches, the entire BIANYS group worked together. We became very creative. After trying phone calls for a long time, very hard to control a group of women on a phone, we came up with our global meeting web conferencing. And this in its own provides an avenue that makes you feel connected, and it allows us to share information in a group setting. Skype teleconferencing can be used widely in schools and other places where they have capability to do so. Teleconferencing is also a good substitute to travel. Webinar trainings are a good alternative to attending trainings as well as conducting them. Phone check-ins, and since we all work from home and the need is to keep connected, all of this is very important. Next. Okay, well, my time is pretty limited.
Yeah, Vicki, you have about 10-15 minutes until question and answers.
All right. What you're looking at now under the success stories and what it's all about are pictures of my son and myself. As Carla mentioned earlier, my son was involved in a traumatic brain injury when he was 6 on July 4th of 1996. A casual ride on a horse and buggy turned out to be a nightmare and a change of life for our entire family. I won't go into all the specific details, but I will say this much. If you look at the two little small pictures on the right, the first one with the red, kind of burgundy background, is a picture of Cameron when he was in kindergarten. If you look at the picture to the right of that, that is a picture of Cameron at the end of first grade. Any of you that have worked with traumatic brain injured children can see the flat effect, non kind of expression, and Cameron never smiled back then and never laughed back then after his injury. Just to give you a little background without getting into all the details, and Cameron was on a horse and buggy for a parade along with his oldest brother, his wife, and his little nephew. And they all were injured, but Cameron was severely injured. Cameron ended up with the left temporal fracture, frontal lobe damage, severe cerebellum, and parietal. By the time Cameron was 8, I was told by the developmental specialist that he pretty much was where he was going to be. I'm proud to say that the picture on the left is my son and his son. My son is now the head of marketing and sales for a radio station, local radio station. He also completed high school with a Regents diploma. Not to say that 13 years of OT, PT, and speech were not needed, as they were, and became a way of life for him. He had full-time TA. He had all the technology that we possibly could come up with, which, by the way, enables him to do what he's doing today. Kind of a tech-savvy nerd. But that's okay. I call him the nerd. Nobody else does. He's a fun guy, and he's a terrific dad, and he's a great husband. There was a lot of ups and downs, people. We live in as I said earlier, in a county where there weren't any choices. We have one agency of servicing. That agency back in 1996 did not understand that children with traumatic brain injury could be serviced under the OMRDD system. It took me 4 years to get Cameron on that system. I advocated hard. I became a brain injury facts coordinator, and then I came back and advocated harder. I realized I needed to understand education, so I took advocacy training and became a certified advocate in education. I also realized I needed to understand how to advocate for individuals with disabilities. And I took policy making, which New York State offered for 6 months. I don't know why. I don't know what led me. I could go into all the mistakes that were made, and there were many from the hospital on. But I knew one thing. I was learning an awful lot of material, and I was learning it very, very quickly. I was 4 credits from having my master's degree in psychology, and somehow that became so unimportant to me. My son's life and giving him back as much as he could have, and close to normalcy became my mission. But after a few years of it becoming my personal mission for my son, it also became a mission for other individuals, other children, as I realized if there wasn't any sources here, what are they doing for other kids? So, i.e., I went to the Brain Injury Association and I begged for this job. I needed an avenue to go out and do what I'm doing. So for anyone who's out there who's wondering, you know, is this something that I might like, or is this something that I might need, or is this something that I could be part of and still live my life in the world of brain injury, I'm proof. And some of the other FACTS coordinators are as well. They came in as moms too, or family members or whatever. We came in with a mission. Some of us came in with goals, some of us came in with a mission, and some of us came in to make the change. I am just so proud to say that from 6, we went through everything from no moods to flat effect to a little boy who could no longer write, could not read, who could not do any type of math, could not do anything, and had just previously, 4 months before, was in a math trial program and IQ tested for the first time in our area. They did the IQs of the young individuals in kindergarten to see if they should try to test out this pilot program in math. Cameron came out in the Genius IQ. 4 months later, Cameron's IQ was 83. Does IQ matter in the world of brain injury? No. Did it matter in the schools? Yes. Did they understand brain injury then? No. Although I'm fortunate to the fact that the classification of brain injury came out in 1996, it didn't mean they understood it. I advocated strongly for my child. I reached out to anyone and everyone I could. I drove my doctors crazy, who are now, I'm proud to say, the same doctors that I turned to help me with my individuals that I work with. But there was a time they couldn't stand me. I turned to the TBI individuals that were at that time under BOCES, and they came in to help me. And I also turned to the head of special ed at Damon College, which I feel I need to mention. This man gave me his time, his efforts, free, and he recently was killed in this bombing, which I will never, ever forget what he did for my family. I met some of the most wonderful people, from Mark Yugoslaver, who worked with Brain Injury Association at conferences. He worked with them to develop LearnEd. But to Shirley Zakaris, who was the head of speech and language, which was very important to me because I forgot to mention that my son is legally deaf due to the accident. He is totally deaf in the left ear, 40% in the right ear, so considered legally deaf. Life has its challenges, but life has its successes as well. Sorry, I accidentally clicked on that. I think that it's important for us to understand what success means in the world of traumatic brain injury. I've never really understood when we have people who kind of have generic terminology for success. So I turned to two of the other FACTS coordinators and said, give me an idea, and I'm doing this very briefly, of what you feel is success in your life with an individual you've worked with. Krista Brown handed me a short little insert about a 20-year-old young man who was out on a joyride with a lifelong best friend on a Sunday in May of the year 2009. They stopped, pulled off to the side of the street where a speed limit was 30 miles an hour, with another young man was driving at a high speed and smashed into their car, critically injuring the individual who was driving. Both boys was determined near death and taken to the nearby hospital where the end of life care was being provided until families could make a determination what to do with these boys. Both boys were determined too severely injured and given a grave prognosis for recovery. Brad's best friend was taken off life supports while Brad's family decided to give Brad every chance possible to continue to improve from there. FACTS coordinator Krista Brown was brought in to meet with the family when Brad was brought to St. Mary's Acute Brain Injury Rehab. Krista helped set the family up with local services to assist with Brad's recovery and rehabilitation. And Krista worked closely with the family. Brad continued to successfully recover and joined the Rochester support group in which Krista ran at the time. And with his family, 6 months after his accident, he walked into the meeting on his own 2 feet with no supports. He led group meetings, became a resource of support, and now works part-time, going to school full-time, and just got his driver's license back last summer. Brad and his family travel around the world as motivational speakers, and they give much credit to the support they receive from the BIANYS FACTS program. Now, Mary typed me up a small little thing, too.
Vicki, I'm sorry. I just wanted to say we have about 5 minutes left before we were going to do question and answers.
Okay.
So I don't know. I don't mean to rush you, but I just want to make sure that
no problem.
We have time. Thank you.
It's no problem. I'll just briefly say that Mary Sheridan, another one of our FACTS coordinators, son was injured when he was 15. He is now 42. Sorry, Mary, I can't go into more detail. But Chris is a success. He lives in his own apartment. He has supports. He is able to make appropriate decisions made with appropriate choices. He lives a good quality of life, as Mary and her husband had dreamt for all of their children. I'm sorry that I can't provide more information, but anybody that would like that can contact Erin or Carla, and I'm sure Mary would be able to send that to you. It's a very interesting story. Mary's been with the Brain Injury Association for approximately 26 years. Next. Oh, this is our last poll question. Sorry, I wasn't looking up.
That's
What
okay.
has been the most significant challenge or need you've experienced or that has been expressed to you by an individual with a brain injury or a family member?
All right, I'm launching that poll question now. Please take a moment to answer. I know Vicki mentioned some of the challenges she experienced. We would like to know what are some of the challenges you have experienced or that have been expressed. All right. I'll give you another second or two to answer, and then I'm going to close the poll and share the results. Okay, so it looks like we have some diversity across the board. 40% said lack of knowledge about brain injury. 44 dual diagnosis, so some people answered multiple. Dual diagnosis issues such as substance abuse and TBI. 51% said lack of services, and that was the highest percentage, was the lack of services. And then we have 23 lack of family support and 30 transportation issues.
Okay. This pretty much leads us right into the fact that I would say this all boils, well, we have challenges here, sorry. I'm going to read this. The most glorious moments in your life are not the so-called days of success, but rather those days when, out of dejection and despair, you feel a rise in you, a challenge to life, and the promise of future accomplishments. By Gustave Flaubert. I think if you were to read that over a couple times, that would impact you quite a bit. Next. All right. Now, under the questionnaire that we did, the poll question, I think that with all the things that you answered, you'll be surprised what comes up in these future slides. But it all boils down to individualism. We don't really know what impacts us most until we start to talk with the individual. I think the beauty of this slide is the fact that it does discuss the individuals. We just can't compare apples and pears. There is none. And that is how traumatic brain injury is looked upon as well. I'm going to say something to you that I say to everyone in trainings, anyone that I work with. The consistency of brain injury is the inconsistency, and that's about all you're going to get for the consistency. You will never see a duplication in any brain injury, any concussion. No diagnosed treatment will be the same. Might have certain pieces that are, but not completely. And the fact that when we add in, if there's dual diagnosis, the complexity of that alone will make it harder. Next, please. Family dynamics. When we begin to establish our relationship with the individuals with TBI and their families, the family dynamics become so important. FACTS coordinator must listen, not just hear. The works of the FACTS coordinator is very challenging. You never repeat what you've done prior. You are always starting over from the beginning. Family dynamics, every situation is different as are their needs. Sometimes the family can be the greatest hurdle or the most helpful. Just a simple example is just the fact that sometimes moms and dads don't agree on classifying a child in a CSE meeting. Dad's afraid of the labeling. Mom's concerned he won't get the education he wants, and you're stuck in between. Somehow we have to remember that the consumer is the child. Underfunding. For FACTS coordinators, it limits our travel, our face-to-face meetings, forces us to use alternative choices and creative options. Next. Other challenges. I find that really unique because when asked the questions and the way that people answered, it pretty much follows the way I discuss most of these. Your dual diagnosis is very difficult to decipher who does what causes what. The mental health world and substance abuse can create as a needed factor in order to make some individuals eligible for the TBI waiver under the older group. Can't get services until these issues are taken care of. Personal choice can be a conflict. We always have to remember, regardless of what we think is best, it's up to them and their choices. Next. Next. Under Project LearnNet, just briefly, I'm going to go through this because many of you states may not be aware of this program. LearnNet, just a short background on this. For years, we had educators and parents reporting that they needed help with their children's adolescence as far as brain injury and the challenges that it was creating, whether it be behavior or learning or a combination of both, and the different ways people were looking at it from the environment of schools and the teachers as well as educators or service coordinators and so forth like that. So in 2005, the Brain Injury Association was awarded a grant through the DDPC, which is which was a grant through the Disabilities Department Planning Committee, and sustaining competency for families and school staff to respond for the challenges of children with acquired/TBI in the home and at school by establishing it through the LearnNet program. Very briefly, the LearnNet program is a computerized program that will walk you through the video instruction, problems that you're seeing, tutorials for each. You can use hypothesis to work yourself through this, compare with other individuals that might be doing the same thing, discuss this in a group setting, maybe along with parents, maybe just the teachers or the parents bringing into them what their concerns are and what their thoughts are. And it is a very helpful tool. And the FACTS coordinator can come in and do a brief training on this program. In the year 2007, the Brain Injury Association of America awarded the Brain Injury Association of New York with the, I'm sorry, Erin, can you help me out here? I just lost my page.
LearnNet has received several awards. Next.
I can't hear. I think it's the Award of Excellence for Programming. Is that true?
Yep.
Okay, great. And it is.
Vicky, is it all right? Is it all right if I actually end here? I'll go through these next slides. I just want to make sure people have some time to ask some questions,
Sure.
just because unfortunately, we're running out of time. So this is some information about the Brain Injury Association, our mission, some information about outreach and some of the stuff that we do. And Vicky did a wonderful job kind of getting into detail about the different roles as FACTS coordinator and how as an association we work together to continue to expand our networks and our knowledge of what services are out there. This is some of the stuff that the Brain Injury Association of New York State provides, and I'm sure can be replicated across the board. I know we have a lot of listeners from other states out there, and I encourage you, if you have any questions about what you heard or if you want to try to replicate some of the stuff that we're doing, by all means contact us. We would love to help. So this is some of the items that we make available, whether it's statewide conferences, symposiums, Project Learn, or LearnNet, as Vicky had spoken about briefly. We have a family helpline, a 1-800 number. That concludes the presentation part. I do want to give, and I'm sorry if we go over, a little bit of time for questions. I'm just going to kind of breeze through these. If you've listened to our webinars in the past, you've seen these slides. We do have one. We're teaming up with DivBIC next month if you're interested in that. We have some events. This is all available on our webpage, but some fun events coming up, including our annual conference. So please check those out. Again, any questions that are not addressed, please feel free to email me. You will receive my contact information in a follow-up email on GoToWebinar. Please visit our website. You will be able to access the recording and the slides for today's presentation. And I have 3 questions already, so I'm going to get into those, and hopefully we don't go too much over. The first question I have is, how would someone go about applying to be a FACTS coordinator?
I can take that question, Vicki. This is Erin Weaver, and I'm the Director of Family Services. We have no openings currently for FACTS positions except in the Long Island region, and you could contact me directly. My information is on our website. I'm in the Albany office. You can email me or contact me via phone, and I can give you some more information. Thank you.
Another question I have is from one of the audience members. Do you assist individuals in meeting the OPWDD criteria for services?
Yes, in any way that we can. We help them to get the information that is needed as far as proof of injury. We make sure that they do meet pretty much the criteria as far as the injury and when it was and so forth before we even send them aboard. But if they're having problems getting documentation, we kind of work through that with them. Can we attend hearings? Yeah, we can. If for some reason they're denied, we can attend a hearing and maybe explain something that's not explained well.
Excellent. I have another question here. Unfortunately, this person left, but it might be helpful to go over the 5 objectives again of the FACTS program.
Being the categories that we use?
Yeah, I wonder if I can go back to the slides for you.
I don't need it. I don't need it.
Okay.
We report on our advocacy hours, our educational advocacy hours, information and resource hours, on our outreach hours, and our training hours.
Thank you, Vicki. Another question I do have is, what do you do for individuals who received their traumatic brain injury after age 22?
There is another waiver service in the state of New York under the Department of Health that takes, originally it was 22 and over. There is a gray area of 18 to age 22, specifically used for those individuals who no longer were living at home or living independent lives, may have had a full-time job, blah, blah, blah. And so they are eligible for both waivers between the ages of 18 and up to 22. So we explain both. If they're over the age of 22, we explain a little bit about that waiver to them. We tell them who is in charge of it. We give them the phone number, and we also can make the referral for them if they're not able to do such.
Thank you, Vicki. And I think our last question for the webinar, again, if you didn't get to ask a question, please don't let it fall by the wayside. Email me the question. I will be happy to get it to Erin and Vicki. The last question I have is, if a veteran was injured prior to their 22nd birthday and the injury occurred during deployment and they are now residing in New York and are over 23 years of age, are they still eligible?
For the FACTS program, yes.
And I believe you had mentioned that before. So yes, no matter the age they are now, the individual is now, if they sustain their injury and it's documented prior to the age of 22, they are eligible for FACTS services. that does conclude our webinar presentation. Thank you again, Vicky. You're such a trooper. I know that you barely had a voice today, and you stuck it out. And we really appreciate it. So thank you so much. Thank you, Erin. Thank you all again for participating. I hope everybody has a wonderful day. Enjoy.
Thank you, everyone.